Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from Prescott, Arizona. Ready to do a mountain bike race tomorrow. Super excited about that. It's the first time we ever did it was last year, and one of my favorite places so far. So I'm super excited for that. Today, we're going to be talking about, you can see it down there on the banner, but we're going to be talking about medications to treat allergies, migraines, rheumatoid arthritis, biologics, NSAIDs, which is non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, many different names, and especially their long-term use. So if you follow Janet and I enough, you realize that Janet and I are two pharmacists that don't necessarily believe in most medications to treat long-term disease. And that includes simple stuff like this, like allergies. And I'll give you a quick story on my allergies. First of all, find out what is causing them. And I will tell you, when I was growing up, I had miserable allergies. So bad that my mom took me to the doctor and they called it hay fever. And even into my adult years, I had allergies, and I would take medication routinely. I think I would take Claritin during certain seasons, and I would take what's the other one? That was non-sedating. Allegra. I would switch off on those, and I would take diphenhydramine or Benadryl when it got really bad. Now, one of the problems with Benadryl or diphenhydramine generic is it causes drowsiness. In fact, in over-the-counter sleep aids, the active ingredient is diphenhydramine, so it can cause a lot of drowsiness. But I will tell you, when I changed my lifestyle about 15 years ago, my allergies just weren't as severe. I just didn't have as many allergies, so I didn't have to take those medications. And I already mentioned some of the side effects of drowsiness, but what else? What are the side effects does diphenhydramine have, Janet?
Dry mouth. You can feel hungover. You can have dry eyes. So we actually use it sometimes for the decongestant part of it, of drying out the sinuses, which in a roundabout way could make the allergy symptoms worse over time.
And I mean, it can have urinary tract problems as far as urinary retention. It can have sexual dysfunction as far as like orgasm problems, possibly even erectile dysfunction. All in all, it's just a dirty, bad drug, diphenhydramine.
Not bad, but dirty.
Yeah.
It has a lot of side effects that can be used to your advantage, but not long-term, short-term.
Right. So, and it works wonderful. It's an antihistamine, and usually allergies is caused from a release of too much histamine. So, which is just a kind of a inflammatory response to something. And diphenhydramine works great to block that. There is no prescription drug that is better than diphenhydramine at blocking histamines.
Besides maybe steroids over time.
Yeah, that's true. I was thinking more antihistamines.
Yeah.
But then because it had so many side effects, they came out with other ones like Claritin and Allegra that had less side effects.
There's a whole slither of them now.
But here's my opinion on it. It's like, and Claritin and Allegra, I think, are fairly innocuous when it comes to toxicities and side effects, less than Benadryl, at least acute side effects. But long term, I don't know if we really know. But again, instead of just treating the symptom of the allergies, why don't we fix the problem? And why are you having this allergic response to something? Now, all of us are probably allergic to something in a certain degree, but we can control that also. If if you think about it, our immune systems are created to respond to certain things, but not over respond. So if we have a healthy immune system, and what are those things that we do to keep a healthy immune system? Sleep.
Huge.
What else?
Well, exposure for one thing. I mean, limit your exposure if you can at all means. So that would include your daily activities. So things that you could do in your house, of course, would be actually change the filter in your
HVAC system.
HVAC system. You could also make sure that your carpets are clean or eliminate your carpets. Some people just totally eliminate them. It could be animal dander that you have an issue with. And unfortunately, if that's the case, perhaps limit what kind of pet you have to eliminate some of those situations. But the other thing about lifestyle is it could boil down to also a diet issue. And Shawn and I talk about this because people don't realize that pure sugar in the body actually it causes a lot of inflammation. So anything that you can do to take the inflammation down is important. And I know this even just from our veterinary visits when we had a dog that had food allergies, is that we took away everything that was irritating him and causing inflammation. And so there were no little treats from the side to give him the opportunity to have an inflammatory response. And I know people might find that a little bit difficult at times, but if you take away as much as you can and eat as whole and not as processed, you're going to lower your inflammation overall in your body. So your response is not going to be exaggerated.
One of the things we started feeding Scruffy, our dog that had skin allergy problems, was a meat-based diet.
Right.
So we had to take all the grains out of his diet, which can be inflammatory themselves. So focus on meat and think about what dogs usually eat in the wild. They eat meat.
Yeah.
So then his problems went away. We didn't want to put him on medication long term. Speaking of animals, I used to be, deathly is not the right word, but extremely allergic to cats. And I was very concerned when my teenage boys brought cats home. And Janet knew I was allergic. My boys did too, but you know how that goes. They won. And I will tell you, I don't have problems with allergies to cats anymore. I didn't realize that. Is it because of my diet is different than it was when I was a kid? It sure could be. Is it also because I slowly introduced myself to cats again and let my body take care of that and respond appropriately? Probably. But I will tell you, when I was a kid growing up and I had miserable allergies, I have a twin brother also, and we would be so congested and we couldn't breathe and it was miserable. But we ate like crap. We didn't eat real food. I mean, we ate all this processed garbage. And think about that. I think, when you think about some of the things that we're allergic to, whether it be, some things in nature. Well, if you eat real food, you're going to be exposed to those things in your food. For instance, we were talking with a colleague the other day about peanut allergies. Well, one of the worst things we ever did for peanut allergies was tell people to quit eating peanuts, because now everybody's allergic to peanuts. Not everybody, but a lot more people are. Where in reality, there used to be very few people that were allergic to peanuts because they used to be exposed to them. When we're exposed to those things in real food, then our bodies are going to mount a response to them, an appropriate response to them. So when you eat raw dairy, Janet grew up eating raw dairy. That might be one of the reasons she didn't have problems with allergies, and I did. I didn't grow up on a dairy farm like her. Janet grew up eating steak, potatoes, real food out of the garden. I didn't. And that might be a part of the problem. So don't ever eliminate that diet can be an issue. And it's not just what you're not eating, but it's not just what you are eating, but it might be what you're not eating.
Right. And kind of a natural approach too that we learned with our pet was using Ortho Omega or Omegas because the fish oil itself was very healing and helped lower the inflammation in a natural way. So it wasn't like you were giving him medication, but you were giving him nutrients. And so that's something really important to think about. Another one that would be really important for humans, it would be vitamin D, because vitamin D is something that usually we lack in where we live in the northern latitudes, and that helps reduce inflammation. So nutrients are super important, and some of that comes from maybe the lack of it in our diet. The other thing that Shawn and I talk about is sleep. And the reason we talk about sleep is because if you're always on edge and you don't get that good sleep, then your body is not healing and preparing for the next day. Short-term use to treat allergies are not bad. I don't want somebody to suffer. But a lot of times when we start doing short-term uses, we just keep adding on. So you get an antihistamine, and then pretty soon we have a steroid. And I don't want people to use steroids long-term. I mean, you can get them over the counter, nasal preps, things like that. But it's short-term use only. So when you get comfortable, we need to stay, come off of it. Nasal chrome is another one. I kind of like nasal chrome a little bit better because that's going to kind of prevent the response versus something that is going to cause, the drowsiness or like steroids, long-term use, just basically your body gets tolerant and the side effects from them long-term is not good. So that's why we want to avoid them, just short-term. But here's another thing that people forget too. Hydration is huge because sometimes, especially where Shawn and I live or where we are visiting right now, the moisture in the air is not your friend because it's very, very dry. And so in order to remove some of the things in your nasal passages, it can be kind of difficult. So showers, semi-showers, nasal saline is a super safe thing because saline is something that's going to be non-irritant to the tissue, and that helps loosen things up. In fact, we used to work with an ENT in Moses Lake who would always talk about hydration. He would talk about using the nasal spray. And then we worked with pulmonologists who always talked about even using some spices in your food to help just naturally give you a response of your body to start loosening things up naturally. And I think there's some truth to it because anytime we have something that's a little bit spicy, you do kind of, your airways start
For sure.
loosening up. I'm not a huge fan. I know there's a lot of people that will do these, what do they call those, Medipots. I don't know if we have to be that invasive, but normal saline, you can't go wrong. And especially with small children, even when they have a cold, it just loosens up the gunk that's sitting there and you can eliminate it in a more natural way without having to be sedative with medications.
I'm fine with neti pots and nasal irrigation. I personally have never done it, and the thought of it kind of grosses me out. But I think it makes a lot of sense to completely irrigate your sinuses. So I'm for it, because you usually use just saline, and that's pretty innocuous. So let's move on to migraines. If anybody has any questions, please put it in the comments and we'll ask. I'm going to stream. Kelly Young, thank you for watching, one of our loyal watchers and viewers and listeners. I had the absolute worst cat dander allergy. Yeah, I echo that. And, still, let's just say acutely, if I had an allergy attack, I would definitely use something. And especially at night, I would use something so I could at least sleep. And I would just take diphenhydramine because it's going to cause me to be drowsy. And then I would just go to sleep and probably wake up better the next day. So, but then realize what caused it and try to stay away from that trigger.
Right.
So,
so if you had a huge trigger, the cat probably would have to go.
Yeah. I remember too, my brother and I had bad allergies. We were working in wheat fields and corn fields. Growing up, irrigating in farms and circles and moving hand lines. And the doctor prescribed Seldane, one of the first non-sedating antihistamines back in the 80s. And then it ended up causing heart problems. So they took it off the market. But one of the things he said back then was, I think you need to change jobs. And of course, we were only doing this for the summer to make money for college. So it wasn't going to be our long-term career. But, I appreciated him saying that because, if your job is messing you up, don't take medication to overcome that. I mean, same thing as this. If your job is messing up your sleep, get a new job. So, even if you're working, or I should say, especially if you're working nights, get a new job. I mean, seriously, long-term, it's not worth your health. So let's talk about migraines.
Which are typically in women. There are some men that have migraines, but again.
So what do women have different than men? Let's just say that.
It's hormonal and it's cyclic usually.
Yeah. Migraines are usually almost always cyclical around a woman's cycle. So that's the first thing I ask. Do they follow your cycle? And then sometimes they'll know, sometimes they won't, but you ask them other questions, about, well, is your cycle regular? Well, no, I'm very irregular. I don't cycle for a few months. And so then they might not know if their migraines follow their cycles. But Ultimately, a lot of times it does. Well, if your migraines follow a woman's cycle, you don't lack some medication to treat your migraines. Honestly, I don't even know the latest and greatest medications to treat migraines because I don't believe in them necessarily. What was the one popular one that first came out? Imitrex. It was available by injection. I think it was 6 milligram injection, I believe, with an auto injector. And then they made a 50 milligram dose orally, I think. And it works on a dopamine receptor. But again, what's causing the migraines? You want to take something every day for migraines. And I understand, I mean, not personally, because I've never had a migraine personally, but I understand how debilitating can it be. But don't you want to fix that problem? What are some other drugs that they use to treat migraines? Antidepressants. Sometimes they use Effexor to treat migraines, and you know what? I don't even know if it's FDA approved for that, but I will tell you, anybody that's ever tried to get off of Effexor, it's like getting off crack cocaine. Not that I would personally know, but it's very, very difficult to get off because you build up a tolerance to it. And then when you get off of it, you will have side effects trying to get off of it. You'll have, withdrawal syndrome. So you have to slowly taper off. It's a perfect drug for big pharma to put you on. So once they get you on it, you can't get off of it. So it's very, very scary.
Sometimes too, it can be related to exposure to certain things. I mean, we've had a friend that had migraines partly due to overuse of caffeine. So there could be, again, a dietary issue that's there. I do know with many women when it's cyclic that we talk about the B vitamins and making sure that they get a healthy level of that because that could be a trigger as well. Methylated, obviously, of course, would be the best answer for that. But it could be daily activities, like Shawn said. It could be your working nights that's triggering it because you can't get your cortisol levels and melatonin levels in the right place. Long-term use of exposure to computers and phones, not as bad as it used to, but light can be an issue. Stress is always something that we have to deal with in life that can trigger migraines. And again, short-term meds to help abort, I totally understand because you don't want to stay into it, but now I think they're doing treatments with Botox.
Oh yeah,
people doing that, which in a little way could be a good trigger for your immune system to respond. So I'm not opposed to that, of trying a treatment like that. I just, what the cycle that I don't like is someone that continues having, and then we go down that road of using, like Shawn said, the antidepressants, because the long-term side effects of antidepressants to me are kind of scary. So
for sure,
I would lean more towards what you can do in your activities to control it. Again, food and diet, anything that's going to take inflammation, your B vitamins, balancing your hormones, eliminating things like caffeine if you can. What else?
Well, let me talk about the caffeine one. I had a friend in a friend in college, a pharmacist friend in pharmacy school, and he had problems with headaches. And he went through this caffeine rehab program and eliminated all caffeine for 30 days, went through withdrawal and yada, yada, yada. And then he was headache free. Well, I talked to him a few years ago and, he relapsed. And now he's on some expensive biological drug every month to fix the headaches. And then, this is what typically that healthcare providers do, especially pharmacists. They drink the Kool-Aid. They learn all about all these fancy drugs, so they must need them. And I scolded him. I said, dude, you should be ashamed of yourself. I said, what's causing your headaches, and you're just going to take this expensive drug because of it. And of course, here's part of the problem. He works for a hospital. They cover his health insurance. So he gets this drug for a monthly copay. If he had to pay out of pocket, he would not be buying this drug. But that's just the least of it, the financial portion of it. What are the long-term side effects? I don't know. I don't care. But it can't be good to put any kind of drug like that in your system for the rest of your life. Fix the problem. And do you really, for those of you that suffer with any kind of chronic disease, do you really want to be held captive by big pharma that the rest of your life you have to take a drug? That is not necessary. Our bodies were created wonderfully. our bodies were created not to have regular migraines. We got to figure out what the problem is and fix the problem. Don't just treat the symptom with a drug. The other thing about headaches I was going to mention, I don't remember. That's all right. We'll move on to rheumatoid arthritis. And by the way, you're going to see a pattern if you follow us enough on social media. You're going to see the same pattern over and over again. And it sounds like beating a dead horse, because if you talk, we're going to talk about all these allergies, migraines, rheumatoid arthritis, cancer, NSAIDs. We're going to talk about all of them, and the treatment is the same. Our answer is the same. Find the problem.
Root causes.
Yeah, find out what's causing the problem. Don't just treat the symptom. Seriously, and so you're going to hear that over and over again. Rheumatoid arthritis. What's causing the rheumatoid arthritis? Why do we have 20-year-olds with rheumatoid arthritis?
Well, there's some thought that there's, an exposure to something that's not natural to our body. And Shawn and I have thought about this a lot, about what would cause that. Certainly it could be exposure to something in our environment. And I think there has a lot to do with that, especially when it's a chronic problem. And many times the injury might have already happened, but what we can do to keep that inflammation down, again, is the story's going to be the same. It's going to not live a sugar high diet. We're going to ask people or suggest that they lower that and move more towards maybe protein and fat, vitamin D. Your nutrients like fish oils are going to be super important. I'm sure methylated B vitamins would be in there, but anything, vitamin C, antioxidants, all that. But proper sleep and nutrition is going to be huge, because your body is made to heal. And if you don't give it the things it needs to heal, it can make it far worse. And it's unfortunate a lot of times that, like Shawn is talking about, the only answer we usually get, unless you have doctors that look for the root cause or other healthcare professionals that are in the prescribing realm, if they're not looking for what's the trigger, what's causing issues. And, it's always lifestyle. It's always things that we ingest or are exposed to. So look for those things that you can control, because again, then you're not a slave to some big pharma problem. Because, I'm not saying that there isn't times that it isn't appropriate to have help in that realm, but not to the point where we are slaves to it.
And specifically in parentheses, we had one of our listeners and viewers ask to do a little segment on rheumatoid arthritis, and especially methotrexate.
Right.
And methotrexate is probably one of the older treatments for arthritis that Jan and I learned about 30 years ago in pharmacy school, and it is a nasty drug.
Along with the steroids.
Along with corticosteroids, which have long-term complications. So ultimately, you need to find out what's causing rheumatoid arthritis. Remember, rheumatoid arthritis is an autoimmune disease. Auto meaning self, immune. Basically, our immune system is attacking itself. So Janet's been very careful the last few minutes so we don't get censored, but I'm just going to go say it. What has changed over the last 50, 60, 70 years that we have so many autoimmune diseases like rheumatoid arthritis, like asthma? Why do we have so many of these diseases? Well, it possibly could be because of all the vaccines that we're getting when we're children and even adults. Vaccines do interact with our immune system, right? That's the only way they can work. So it has to make you wonder if that's one of the things causing the problems. Now, do I think food and diet cause a problem too? Absolutely. And even if you've been vaccinated, you can overcome a lot of things with food and diet. I know of people that have changed their diet to carnivore, and their rheumatoid arthritis goes away. Carnivore diet, a red meat only diet, is one of the least anti-inflammatory diets you can eat. Many other things that grow in the ground, whether it be vegetables or whether it be some fruits, especially vegetables, they have things in them to protect themselves from not being eaten. Like, for instance, why are jalapeno peppers hot? Why are they spicy? It's so animals don't eat them. That's really why. So maybe when we eat things like that, it could cause problems. Not with all of us, but with some of us. And of course, it might matter on how much we eat too. So whereas nobody has, I shouldn't say nobody, but it's really, 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 really rare that somebody is like has an allergic reaction or a bad response to red meat. It's very, very rare. Chicken and pork a little bit more, but not with red meat. So if somebody has rheumatoid arthritis, you know, even the fancy, I should say not even, but some of the fancy drugs that you see advertised on TV now, that are thousands and thousands of dollars a month. Why don't you try changing your diet? And actually, we interviewed a rheumatoid arthritis that is, or a rheumatologist that is, she is at the forefront of that, of teaching people to change their diets rather than just prescribing a drug. So if you want a link to that podcast, send me a comment and I will send you that link.
So I do have some thoughts about methotrexate, because early on in Shawn and I's career, that was one of the go-to drugs as far as treating. And the downside is it can be very debilitating. The side effects are real. Nausea, lack of energy, lethargia. And then the other problem is then we throw in the steroids. And the problem with steroids long term is it can certainly take away your bone health, your ability to fight infections and things like that. So right now, what we do see that I embrace slightly more is using products like low dose naltrexone. They do use that because the thought behind using that is that at a very low dose, it's supposed to calm your immune response. And I think that's a thought that could be important, that we're calming rather than triggering, because I feel like even biologics, for that matter, the side effects can be that it lowers your immune system response. Well, to me, I think that's working against the issue. So it doesn't make sense long term to be working against your own body's immune system. And so anything that we can do on the nutritional side, or even something like low dose naltrexone that's going to lower the immune response, is where I would go. Again, we talk about fish oil, we talk about antioxidants like vitamin C, methylated B vitamins, vitamin D, but probably the best thing would be also making sure that your body is able to heal, which would be sleep. So I'm not a proponent of using long-term use of sleep meds or anything like that. So I do think low-dose naltrexone does have a place, because people do seem to sleep better with that and heal. Biologics, I struggle with it because, again, the long-term side effects, when they go down the list of them, can be pretty scary. And
even short term.
Right, even short term. So, and if we think about how long have these products been used in humans, not for very long. And so I feel like you're being used for an experiment. And that's just my opinion. I do know people that do use it. And since it could be out of desperation that, they've tried all different methods, but I do know one friend in particular that's had arthritis most of her life. If she's really honest to herself, she would eliminate the inflammation that she's putting in her daily life. And the other thing too, there's a lot of chemicals that we are being exposed to that we weren't probably 50, 70 years ago, that have, we've ingested and as part of our life that we could eliminate as much as we could.
And just remember about methotrexate, it is a chemotherapy agent.
Right.
It's chemotherapy meant to kill cancer cells, which means it kills our cells too. And of course, we probably use it in a lower dose for rheumatoid arthritis than we used to for chemotherapy for cancer. Yeah. But think about that. Is that a drug that you would want to take the rest of your life? And the biologics, we're going to talk about that for cancer, but Jan already talked about them for rheumatoid arthritis. These biologic drugs, they've been around for maybe a decade, maybe a little bit longer. I don't know. But they're supposed to, help our immune system respond to these different diseases. I don't know about you, but anytime there's a drug that is supposedly going to make my immune system have a response, that's kind of scary to me. Our immune systems are created pretty wonderfully. And if we give them the right input, sleep, diet, exercise, and we stay healthy at a healthy body weight, things like that, our immune system can take care of a lot of things, including cancer. Here's my whole thing about cancer. Let's just talk about chemotherapy and cancer. So, what do? We give chemotherapy to try to wipe out the cancer. And of course, the oncologist will tell the people, they'll tell the patients this: we're going to give you as much as you can tolerate without dying. They literally say that. Basically saying, if we give you enough of this, it's going to kill you. So we're going to try to give you just enough where it doesn't kill you, but it kills the cancer. Let's think about this. I think any oncologist, if they're honest with themselves and honest with their patients, they would admit this: there is no chemotherapy agent. Let's put it this way. There is no treatment that is going to kill every cancer cell, period. It is absolutely impossible. So you're going to have cancer cells left over after your treatment, whether it be chemotherapy, whether it be radiation, whether it be from these biologics, right? What's important is that how your body can then naturally fight that cancer. We get bombarded with carcinogens and cancers all the time. Our body, our immune system fights it. So what happens when your body has been wiped, your immune system has been wiped out from radiation and chemotherapy, and then you have to fight the cancer? Your body's immune system has to fight the leftover cancer cells. Doesn't sound like a good situation to me at all. And when you look at the absolute versus relative numbers of how effective most chemotherapy is, I'm assuming the biologics are the same for cancer, the numbers are dismal. It's not very effective, and it kills. There is no fact in my mind. There's no fact in anybody's. There's no lying about chemotherapy killing people. It does. We've seen it personally in our patients. It kills people, and you need a strong immune system to fight off cancer. So killing the immune system doesn't make a lot of sense to me, Janet.
No, we're you can kind of track our position. I haven't been put in that scenario, so I understand that everybody needs to make their own personal decision. But one of the things that is very important, I think, in this is what is the risk and what is the expected outcome. So let's say they tell you this is going to give you 5 or 10 more years, but what is that percentage? Is it 5 or 10 more years, or is it, you have less than 0.01%, that you're going to have 1 or 2 more years of life, and it can be very miserable. So, what do those numbers mean when they throw that out to you? Because relative risks versus, what's really happening could be something quite different. So I think understanding that you actually have choices, because a little backstory is we have a friend who was a very healthy individual, and she was diagnosed with cancer. So she did have surgery, and she did do some radiation, but she refused the chemo. And the reason she did is because that type of treatment that she was offered really made no difference as far as what her outcome would be. So, you have to ask those questions. And so her approach, and I think this is something that isn't really talked about in this realm, is really, she's as healthy as she can be, which means she exercises, she sleeps, she eats as best she can. She does use fasting, and I don't know how she does it, but she does this 5-day a month fasting. So her own body can handle the situation. And she's not a huge, she eats as natural as she can, and she's eliminated as much pure sugar as she can. So there's less inflammation on the body as all possible. And I think that's something that is really forgotten. People get treatments, and then, they go through everything that they're told or asked to do, but we don't ask what's the outcome. My favorite thing about that is, you have to treat 800 people before you have one person that responds well.
Number to treat.
So you really, really need to get down how many people does this work successfully, and how many of these people are going to have a good outcome in this scenario that you're sharing with me? Because, a lot of times we don't ask those questions. What would it be better, if I did one thing and then just one thing versus everything all at one time? And what if we spread it out? Why is it all immediate? Ask the questions. And that to me, I think that's the biggest thing, is we just respond and do what we're told, but we don't really find out what's the really long-term thing that we can do. And I look at biologics from and chemo and radiation at a very skeptical place. I want to know, if it's me, what would be my best outcome? What are my choices, and what is the path that might be healthier? And asking questions can be actually, I think, the healthiest thing that we can do. And if we're being shut down to ask questions, then you need to find somebody else that's worthy of talking to you as a human being, because it's not their body, it's your body.
That's right.
You're in control, and you should be able to ask the questions. And alternate treatments, what are some safer alternative treatments that are available to you? And if they're not willing to discuss that, then I think you need to find, a different path. And again, root causes. What's the root cause of that cancer? If it's, skin cancer, is it breast cancer? Is it colon cancer? I know in my family, on both sides of the family, colon cancer is rampant. Well, be proactive, do what you can to eliminate the inflammation. That's made a big difference, I know, for my own self, with the development and the polyps being less, because I changed my exercise, I changed my diet, we've changed our sleep. So anything in my human possible activity, that's where I take control of, because I feel like that puts you in the driver's seat.
For sure. And remember, on those studies with cancer, big pharma is good at manipulating the data. And I say that very loosely, but they do. And here's how one of the things they say is, they say, well, they'll give a number about how many people were, what percentage of people were cancer free, and how it decreased somebody's cancer, but they don't necessarily tell you how many people it killed in the meantime. They just say that, it decreased the cancer rate. Well, yeah, but how many people did it kill also? So, look at overall outcomes, not just, if they died of cancer, but if they died of a side effect from the drug, which big pharma is pretty good at hiding that. So let's move on to NSAIDs, non-steroidal anti-inflammatory drugs. The reason they call them non-steroidal is because we talked about steroids already to treat some of these things. And steroids are great to treat a lot of acute things. For pain and things like that, because it just basically, corticosteroids, unlike anabolic steroids, they're completely opposite. Right. Corticosteroids are catabolic, not anabolic, so they kind of waste your body away instead of build your body up. There's a big side effect, and you can go through every body system, whether it be your your muscle or your bones, and they atrophy those things. So
short term.
Right. So, but they wanted to find something that didn't have as many side effects as the steroids. So they came up with the NSAIDs, non-steroidal anti-inflammatory drug. The first one, I believe, was ibuprofen in like the 1980s. And one of the side effects that we found out right away from it was, Janet?
Oh, GI bleeds.
Yeah, GI bleeds. People were having gastrointestinal bleeds. Now, let me move back. Aspirin is also a non-steroidal anti-inflammatory drug. And of course, it causes GI bleeds. So they were trying to find something safer than aspirin also. So they came out with ibuprofen, GI bleeds, and kidney dysfunction. It can cause kidney disease. And many people have had their kidneys be ruined by taking chronic NSAIDs. So long-term use, I'm not a fan. I use NSAIDs. I broke my wrist. I use NSAIDs. I broke my foot. I use NSAIDs. Short-term, like a few days. And guess what? You can see some of those side effects coming on. You start getting nauseated. If you take a high enough dose, that actually works. You start getting nauseated. You might get diarrhea. Those are those gastrointestinal side effects that are coming on.
Yes. So we aren't opposed to using a pain medication, especially the non-steroidal, which would include not using prednisone. I mean, let's be clear about what the steroid is prednisone.
Mostly. Yeah.
So we're fine with that, especially, even for some pretty big, like I had a C-section that worked great. Like you broke a bone, but there are some alternatives to using it long term if you did have a long-term issue. And some of that could be just a topical. I've talked about that to my family with my mom having some knee issues and arthritic issues as she aged. You can use a topical and get away with not having to do the ingestion through the GI tract. And if there is some long-term pain, if there's something you can do to help it, again, like we've talked, whether it's diet, sleep, exercise, or maybe it's physical therapy, learning or exercise, learning how to stretch. I mean, the older I get, the more I realize that, my grandmother wasn't crazy when she said she stretched before she got out of bed, because if you don't use those muscles, you lose it. And dexterity and being comfortable in our skin as we age is really important. So stretching is huge. So if you have some kind of chronic thing, be careful about long-term use. Short-term, fine. Even if you had a headache, short-term, fine, but long-term, no way.
No. And I'll tell you a personal story with mine. I had flank pain. Like I thought it was my kidneys. So I thought I had a kidney infection. And turns out I had sore muscles. It was my back muscles. And I got a massage and all of it went away. And I just thought as a pharmacist, this has been a few years ago, I thought as a pharmacist, how many times have I dispensed chronic medications for chronic back pain and all somebody needed was a massage? So now I routinely get a massage every month to prevent those kind of problems. And I do my own stretches and stuff too. But if I would have and I talked to a friend of mine who is a nurse practitioner, and they said, well, I can prescribe I can prescribe you some NSAIDs and I can prescribe you some muscle relaxants. I'm like, I know this sounds weird to a lot of people that we're pharmacists, and I look at that and like, I don't want to take drugs for that. Anyway, I got a massage and it went away. And it's just a reminder, find out what's causing the pain.
Right.
And fix that part instead of taking a drug to just treat the symptom of overcoming it.
Right. And if that's not a possibility, again, I reach for topicals. I mean,
topical NSAIDs like Voltaren gel is what she's talking about.
Right. And they're really non-invasive because they eliminate the GI or the stomach issue totally, and you have control. So if you had an injury or something that happened that, for example, Shawn and I, we obviously do not want to use any pain med that's going to cause drowsiness or impair your thinking. So you can apply that throughout the day as needed. So it's as needed thing. But the root cause, like in Shawn's situation, the root cause is he had an injury or an overuse. Overuse is something in our society that we forget about. So, maybe it's your posture. Maybe it's your shoes. I had some issues where my shoes weren't fitting right. Funny story is when we first moved into our house, which is almost 20 years ago, Shawn started having problems with plantar fasciitis. And really, what we needed to do is wear shoes or something in our house because we had introduced tile and we had never had tile in our house before.
Right. And I was friends with a podiatrist, and he asked me, he's like, one of the first things he asked me, I told him my feet were just killing me. Of course, I was about 60 pounds overweight too. That can't help. And by the way, if anybody has plantar fasciitis and they go to a doctor and the doctor says their weight has nothing to do with it, get a new doctor. Seriously. I mean, just think about that. That is just basic physics. So, but one of the first things he said was, did you just recently do construction in your house or whatever? I'm like, yeah, I moved into a new house. Sure enough, I was wearing no shoes and I had bare feet on hard tile, and it was causing plantar fasciitis, my feet to just break down. So I started wearing my Nike sliders, and I've been wearing them ever since for 20 years. But losing weight would have helped too. So we got a comment. When Thank you, Leanne, for
Yes.
commenting. When you breathe deep and relax into the pain, you can release the muscle restriction and working with trigger points. Absolutely, you can. Thank you for that comment.
In fact, we just spoke to a practitioner Wednesday, and she was talking about trigger points and, how important that is as far as dealing with the pain as well. And I totally agree with that. Um, Breathing and relaxing makes a huge difference in pain response.
For overuse injuries, so Jen and I both being bikers, you can get a lot of overuse injuries, from hamstrings to your hip flexors. One of the things that's important when you're overuse injuries is to do other exercises. So that's why it's so important that we do gym work. So
Stretching.
yeah, we do gym work that does include stretching and includes weights to overcome the other those overuse things. So we strengthen up our hip flexors, we strengthen up our glutes, our side quads, things that sometimes your lateral legs, sometimes at a bike, pushing down straight all the time doesn't work. So you want to work those auxiliary muscles in different ways. So that's why we do one of the reasons why we do gym work. So that's what's important when it comes to overuse injuries, is using other muscles to help the big muscle groups use those other auxiliary muscles, and then they won't get overused.
Right. So for us being at a desk job, a lot of times people forget to move because they become very focused. So that's something too that we encourage even with our own staff, is to move. Don't sit there for hours in one space if you can help it. When you do take your break, walk and move, because that is going to change your perspective and also change what you're doing. Like Shawn says, if you exercise on a bike and that's all you do, then likely to have some kind of issue that way. So moving in different ways. I'm not a big proponent, and this is probably a subject we could talk about all day, but I'm not a big proponent in people doing just one sport, and especially children, because that overuse injury thing is real. And so doing other movements to counteract or to do something totally different. If you're sitting, get up and walk. If you're using a mouse or using something, do something totally opposing to what you were naturally, or what you were, doing for hours, just to offset that. And that's before you reach to things like medication, because, an easy fix with Shawn's plantar fasciitis was to wear shoes.
Yeah, instead of taking NSAID the rest of my life. And then speaking of working at a desk, so a lot of us probably get pain in our right shoulder, and that's from using a mouse, and being bent over a desk using a mouse. So that's also from driving. So I get a massage, and I get this massage. I can feel it right there. I get a massage regularly. But one thing to remember too is how our posture is. So when you're driving, try to drive like this. Posture up, shoulders back, because leaning forward, bent over a desk is the worst kind of posture for our shoulders, and it's going to cause some pain. So, stand up straight, chest out, shoulders back, and that can help some of that. And just get up and move. So, Janet, as we wind this podcast up, what do you want to add before we wind this up?
Well, I'm just going to reiterate our theme. And most of the time we know what's in our life, our activities, and who we are as a human, that we a lot of times know where the problem is, but maybe we just don't know what to do to root that out or come to a solution. So find somebody that's willing to work with you on those ends, because many times if you can work with someone that can help you on the nutritional side, the sleep side, the activity side, then you don't have to be a slave to big pharma, because, how much better would it be to solve something like when Shawn actually started wearing a shoe versus reaching for drugs and causing some long-term issue or side effect.
Absolutely. Absolutely. So we thank you for tuning in to Health Solutions today. We do stream live for those of you that are watching it. one platform. We stream live on many platforms. So LinkedIn, Twitter, actually X. I still cannot get used to calling it.
That's
call
right.
it
Everybody
X.
knows it's Twitter.
YouTube and Facebook, and we have multiple Facebook pages. My personal Facebook page, and we have a Sickened Facebook page for my book, and then our Moses Lake Professional Pharmacy Facebook page, and a Health Solutions Facebook page. Actually, we got one comment as we wind this up. Oh, my aunt, Hallie Miller. Thanks for watching, listening, Hallie, and thanks for the comment. You are welcome. So as we wind this podcast up, we just want to thank you as loyal listeners and viewers for tuning in to Health Solutions with Shawn and Janet Needham. And tune in. Let's see, today's our midweek podcast. Today's Friday. Tune in Monday. I don't know who our guest is, but 12:30 to 1:30, our regular scheduled podcast. Tune in to Health Solutions with Shawn and Janet Needham. Thank you.